Hi, Johann. I'm
Hi,
slightly
Praveen.
confused. Are we in the right session? I see a lot of colors. I see, okay, there's this understanding the times that you've written, but can't seem to see anywhere mental health as such. Ah, yeah, right. This is psychiatrist. So probably that might be the clue. But other than that, are we in the right session? Did we come to the wrong session by mistake?
Don't worry, Praveen. You're very much in the right session. And well, yes, come to think of it, I think we didn't write the words mental health in the slide. You're right. But I think by the time we're through with the talk, we'll be clear on what exactly we're trying to say. So if you're confused, remember you're on the right track.
Okay,
And
that's good.
yeah, so it's all intentional. The confusion will resolve itself in time. So maybe shall we get started with our talk, if that's okay?
Yes, yes. I think let's see what
Sure.
you have in store.
Sure. And the theme of this conference is so important, and I think it's a very wonderful theme: understanding the times we are in. And that's why I've put that as the subtitle of our talk today, because I think it's so important we understand the particular time we're living in order to understand how we can look after our mental health in that context. And with a special reference to healthcare workers, because that is what this conference is targeting. So we'll move straight in, and I think that's a good way to start. Let's first understand the times we're in. Uh, I think, I don't know if I should say we are fortunate or we are unfortunate, but we are in a very unique time. It's been a couple of generations since we've had a time that is so different and unique as we are in this particular time that we are in. And we know if anybody asks you to say one word that describes the time we are in, I'm sure the word would be same for everybody. It would be pandemic, right? I think the pandemic is something that has just been um, absorbing our time and completely dominating the time we are in. And it's not been a very long time when you think about it in the grand scheme of things. When did we first hear about this virus? Sometime in November, December of 2019, we started hearing about some strange thing going on in China. It was all very mysterious and mystical, and it looked like a movie, and we didn't really think it would make much of an impact. Then suddenly we started hearing of a few cases outside here and there, and even then, I'm sure all of us were very skeptical. I was very skeptical for one, and suddenly, out of the blue, somewhere in March, WHO declares it's a pandemic, and then it's all over the place. You're hearing about, countries going into lockdown, huge numbers of patients being tested positive, many deaths. Countries all over the world struggling, and then suddenly it lands up in India. And there was a time a month ago where India had the maximum number of cases being registered every day and deaths and things. So it's a pandemic. We're right in the middle of it. And it has completely disrupted the way we are living and our entire life. But it's interesting to note that pandemics are not an unusual part of history, even though we may think so. Uh, the last pandemic that was there, the last big pandemic on this scale was in 1918. It's interesting, just exactly a century before COVID-19. And what was happening in the world in 1918? Those of you who are history buffs here will remember. The First World War was reaching its conclusion, 1914 to 1918. And right as the First World War was at its height, there was an influenza pandemic called the Spanish flu, which came out and probably started in the war itself, on the trenches, and because of the unhygienic conditions that people were living in. The pandemic, which killed something like 50 million people, probably more than that, not 50,000, 50 lakh, 50 million people. If you remember, just a couple of weeks back, the COVID-19 worldwide death toll just crossed 1 million couple of weeks ago. And still we think of it as a very terrible pandemic. The 1918 pandemic, the Spanish flu, killed more than 50 million, more than 50 times the number of deaths in COVID in that period of time across the world. So it was really bad. And out of those 50 million, probably 1/3 of them were in India itself. So it was really bad. And even that was not unusual in that sense, because we've had bad pandemics happening at periodic intervals throughout history. So it's not something completely new. So that's something I think we need to understand in our comfort of our 21st century life. We think that pandemics and disasters are something that are very unique and unusual, but that's not really true if we look at history and if we look at the experience of humanity as a whole. And in global pandemics and global destruction at periodic times has happened. And I'm going to take us back in time now, all the way to the beginning, so that we get some perspective on this. So let's rewind and go back to Genesis, go right to the beginning. And we know, of course, the story of Noah is not something that that we're unfamiliar with. We all know it very well, but we're going to focus a bit there on Genesis chapters 6 to 9, which tell the story of the great flood. And we know that, just prior to that, it talked about in Genesis, the first 2 chapters of Genesis talk about the creation of the world, and then it talks about the fall after that, and how evil came into the world, and how human beings became very evil. And that's not going to be our focus. We're going to focus straight on the flood. And we know what happened in the flood. The world became very evil, and God felt so strongly about it that he felt he had to restart and renew creation by destroying everything and starting from scratch once again. And he chose Noah and his family to be the ones to build the ark and to maintain some sample of life to be continued and protected in the ark while the rest of creation was destroyed, and so on and so forth. So we know that story. And what I want to stress on here was that it was a global phenomenon, and there was global destruction. The entire world faced a major crisis at that point of time. So it's a good lens through which we can view future crises of this nature, future global crisis of this nature, like the one we're in now. And when we think of it, we are in a flood. So I'd like to just think of that as a backdrop here. And we are going to use an old English word for flood called deluge. I'm sure many of you might have heard this word, but we are going to use this word to give us an understanding of the time we're in. So we just made up this acronym. Don't worry, it's not some standard acronym that has been borrowed from some textbook. Praveen and me just made it up, but we thought it's a good way for us to understand the time we're in. So you can see here, we've spelled it out there, deluge. And I think if we just briefly go through this, we'll understand a bit more of the nature of the time we're in. As you can see, the D stands for death and disease. You can see that death and disease is probably the most obvious aspect of the pandemic we are seeing. We see a lot of people becoming positive with COVID-19. We know many people who have died. Many of us may even personally know friends, family, or associates who have lost loved ones or who have died. So it's a very real phenomena, the death and disease happening around us. But not just the pandemic. Remember that the lockdowns and the restrictions have created all sorts of chaos for the healthcare sector. People with chronic diseases have not been able to reach their doctors. All kinds of other health conditions have been worsened because of the pandemic, and mental health conditions too, which is one primary concern of ours. Mental health problems have also tremendously worsened during the pandemic. One reason because of people with chronic mental disorders have not been able to reach their doctors for help. People with mental health problems have not been able to reach out to counselors or doctors or others who can help them. So there's been a huge increase there. But apart from that as well, there's been a huge increase in suicides because of the tensions that are around, because of the lockdowns. There's been a huge increase in addictions of all kinds. There's been a huge increase in domestic violence, abuse, because people have been forced to spend more time at home. I know many of us are blessed to have had wonderful families in which the extra time at home has actually been an enriching experience, but that has not been everybody's story. There have been many who have had an increase in abuse and violence and trauma because of that. And all of these things have actually worsened as a result of the pandemic. And let's not forget that there's been a lot of fatigue and burnout as well. The people doing the same thing again and again, healthcare professionals seeing the same sort of things, the same stresses happening again and again, same problems, the same restrictions. Many people forced to be at home and not move out, not travel, not mingle with friends. So it's led to burnout, and many people are burning out. We're seeing that increasingly as COVID fatigue sets in on all fronts. So these are all the death and disease. That aspect of the pandemic is very obvious, but it's worth just remembering that and reminding ourselves about that. The E stands for emotions being all over the place. I think this is also something doesn't take much for us to understand. We're all anxious and tensed about our future. Suddenly everything has become very uncertain. We are frightened, many of us. We are, angry. We don't know what to do with our emotions, and sometimes they come out at the wrong time and the wrong place. To people we love, to our colleagues, our family, our friends. Our frustrations come out at the wrong time. So we have difficulty in managing our emotions, our anxieties, our stress, our tensions, our fears, our anger. Everything is all over the place. So I think that's one important aspect of what we're experiencing at this time. I think we can move to the L. The L is very self-explanatory. Lifestyle changes. We're all in lockdowns, or if not lockdown, at least some form of restriction. We're all having to practice social distancing, physical distancing, hand hygiene like we've never had to before. Even people who never washed their hands before are now washing their hands several times a day. So it's been huge, these huge lifestyle changes which have happened. Many people are working from home. Many people are working in environments that put them at risk, and so they have to take new precautions that they never took before. Healthcare professionals are also working in conditions they have never worked in before. So huge lifestyle changes for all of us. The U stands for understanding of self. This is a more complicated one, but still we'll just explain it. Many people, even before the pandemic, tended to have a very low opinion of themselves. They had low self-esteem, or were not sure about whether what they're doing was right, whether they were good enough for their jobs, good enough for their family. All sorts of self-esteem problems were there even before the pandemic. But the pandemic has just accentuated all of these things because of the huge changes in lifestyle and the huge changes in work and restrictions and all. Suddenly we're even more cornered, and we start wondering, are we really good enough for these changes? Are we really good enough for the new expectations on us? Are we good enough to deal with the work ahead, the tasks ahead? It's just accentuated all those issues. The G stands for grappling with new demands. I think that's also pretty clear, because there's so many new expectations on us, so many new protocols, so many new lifestyle changes, so many new ways of doing things. In fact, even this conference, we would have probably been together meeting and eating together while we attend a few talks. Now we're all sitting in different places and connecting online. It's a huge new change for everybody. So lots to grapple with. And finally, the end is very clear. It seems like it's the end of the world as we know it. Because believe it or not, the world is never going to go back to how it was before 2019. Some aspects of this change are going to remain permanent in the way we go forward. Praveen, I don't know if am I making this worse or am I helping here?
I'm also not quite sure. I think you have added to reducing the confusion in that it's a very gloomy situation that we are in. And Yes, we all understand that the pandemic is a difficult situation, but I think people have come here to understand the times much more than that. And is there a ray of hope or anything, or is it? Are we going to end with this deluge?
Thanks for bringing me back on track. But I think if we go back to the Noah story, the great flood story, let's not forget that the story doesn't end with the flood. Of course, that's what we often remember the story as, the destruction, the death, the cleansing that took place. But the story actually ends with a rainbow. So let's not ever forget that. Um, the story ends with God's promise of renewal and God's, you know, instructions to those who came out of the ark: be fruitful, multiply, renew the world, fill the world again, and bring healing and renewal to the world. So that's where the story actually ends, with the rainbow. So we've got another acronym for you, uh, just to talk about the strategies we can do to sort of renew ourselves during this deluge, and that is rainbow. So we'll go through each of them, each of the letters one at a time, and come out with some strategies that we can actually use to deal with the times that we are in. So maybe we should go straight away with the rainbow. Shall we, Praveen? Go straight
Yes,
in.
yes. Let's start with R. Is that right?
Yes, that's right. We'll start with the R. And just to keep you on track, you can see at the bottom left corner of the screen, we've spelled out rainbow, and we've got that little box which will be moving on to each letter as we speak. So Praveen, thanks for that. That will really help us to be on track. So the first letter is R, and I think it's really important. We need to rest and renew. So what do we mean by this? Now, rest is not the same as sleep. I think that's important to remember. Sleep is very important, and yes, we must sleep. We can't emphasize that enough. We need to have a good night's rest and sleep. But rest is not only sleep. Rest also includes, um, things we do when we are awake that renew us and relax us. That is also part of rest. So it's really important that we do that, engage in some kind of uh, activities that bring us renewal and leisure and rest apart from sleep. Of course, sleep is also important. So I think that's important for us to remember there. It's also important that we do exercise regularly, that we try and cope better with our stress. All these things are important, because if we don't do these, we can't rest adequately. So rest is not equal to sleep. Sleep is part of rest. Rest includes other things also. And it's important for us to understand that we must rest in a way that God wants us to rest. And that's where the second R comes in: renew. This is a great time for us to reflect on our past, and introspect and see, were we really doing the right things? Were we on the right track in the mad rush of life that we were in before COVID-19 came? Many of the people we speak to complain about the fact that, oh, we used to do so many things, now we can't do so many things. But it's a good time for us to reflect and see all those many things we were doing back then. How much of it was really required? How much of it was really in line with what God wanted and what was good for us? This is a great time for us to reflect on that, introspect, and renew ourselves, so that, when we come out of this crisis, we shouldn't go back to exactly what we were back then. We need to really see what of those things were really required for us, and what of those things would really help us renew ourselves, our commitment, and help us to move forward as God would like us to move forward. So I think that's an important part of the rest and renewal. It's not just about sleep and relaxation and exercise. Those are all important, but we need to ask ourselves how we can renew ourselves and do what God wants us to do, and how we can align our plans with His. So that's the rest and renew. We'll move to the next letter, A. I like this one: accept and adapt. Now, I think we have to understand that when the flood is happening, when the deluge is happening, that's not the time for us to wonder, oh, we should have looked at the clouds earlier, we should have prepared ourselves better. We're in the rain, in the deluge, in the flood, we've got to accept that the flood is happening. and we've got to adapt ourselves to handle it. So very often we see a lot of discussions happening about this pandemic. If only the Chinese had controlled it better and not let it spread. If only countries had been stricter. If only lockdown had happened in this way or that way. But now is not the time for ifs and buts. Now is the time to realize that we are in the deluge. We are in the middle of the pandemic. It's all around us. And we need to see how we can accept it and adapt accordingly. And let's remember that God wants us to adapt. That was part of what God said when he sent them out of the ark with the rainbow. Fill the earth and multiply and renew it. That included adapting to a world after the flood, and which is important for us. So we have to adapt to these changes, accept these changes, some of these changes as being good. For example, this increased push online. Many of us may have looked at it with a lot of skepticism, but there's certainly a lot of good that can come out of this. The fact that we can do a lot more things online, we can do things which are probably less expensive. It helps us to connect better with people, save resources, save time. So maybe there are the positives of this experience that we should build on and adapt on. Similarly, all this issue of social distancing, wearing masks, personal hygiene, this whole emphasis on health is probably a good thing. And God wants us to adapt in this way so that we take care of our health in a better way. We were probably very negligent of our health in the times before. And these are things which God wants us to accept, adapt, and move forward. And if we change our mindset to this, I think we would feel a little bit less stressed about these changes. So that's what the A is about. We'll move to the I. And the I is an important one. It's really a solution to what the U of the deluge was. The U was, remember, understanding of self. The I tells us how we can sort that out. We need to remember that our identity is not, as you know, I'm not Johann, I'm not Praveen, I'm not just a psychiatrist, I'm not just a doctor. I am a person who has been made in God's image. So my identity should be built on the fact that I am God's image bearer. There's a beautiful Latin word for that. Thanks, Praveen, for putting it there. Imago Dei, which actually talks about that, being built in the image of God, being created in God's image. And it's so big to unpack that. But there are a few points from that that we can try and understand. I think the first thing to remember is it's not just, a good Christian who is built in God's image or created in God's image, or not just a Jew who's created in God's image. Everyone, every human being, by virtue of being a human being, is created in God's image. Whether we're good, whether we're bad, male, female, tall, short, whatever our race, whatever our ethnicity, whatever our background, whatever our religion, whatever, whether we're disabled or not, or whatever, we are created in God's image. Now, it's a different thing that we have fallen and therefore evil has come in and perverted this image. But that's not how we were created. We were created in God's image. And that should be where our identity is rooted. And remember that God has created us and put us in a place where he thinks we can work. He has already designed us to be capable of the tasks he puts before us. So he would not have given us tasks if he didn't think we were capable of doing them. So that's really important to remember. And remember that we bear his image. We bear many of his characteristics. And we'll come to that. There's more coming in there. But one of the key things to remember is that we should never forget the fact that God created us with an intention in mind. And if he has given us a task, we are good enough to do that task with his help because we are created in his image. So I think that's really an important thing to remember. We'll move to the next letter. The N stands for normalize emotions. And I think this is a related one to the image, being part of God's image. Because remember, one of the things about being created in God's image is that we experience emotions. That's part of being created in God's image. Remember, a tree doesn't have emotions. A machine doesn't have emotions. Why? because these things are not created in the image of God. God has emotions. God feels joyful and happy. God feels upset. God feels angry at times. The Bible even says God feels jealous when we turn our attention away from Him to other things. God feels sad, so God feels angry. So God has all the whole gamut of emotions that we experience are also experienced by God. So it's important to remember that emotions are normal. They are a normal part of human experience. It's part of our being made in the image of God. So when we're anxious, when we're sad, when we're happy, when we're angry, these are normal parts of being human. But of course, remember that we are human and sometimes our emotions go out of control, overboard. That's where the problems happen. It's not wrong to be angry. It's not wrong to be sad. Each of these emotions was put there by God for a reason. For example, we could say that anger, for example, has been put there because anger is the trigger. Anger gets triggered whenever some injustice happens. So the reason why we deal with injustice is because we feel angry about it. So there is a reason why God put anger there. Anxiety and fear were put there to protect us from danger. So there's a reason for that. So each of these emotions, if you analyze them, there's a reason why they're there. And we must accept them as normal. However, if they do go overboard, it's important that we learn how to deal with them, and we'll come to that in some time. But the first thing to remember is we should stop feeling guilty about being anxious or fearful or angry, because they are there for a reason, and it's part of our being created in God's image. We'll move to the B. B is a good one, and I think it's important that we also follow our instructions there. We should be good stewards of time. Time is a precious commodity given to us by God, and there's only limited supply of it. We can't store it, we can't keep it in a bank and invest it. We only have it when it's there. So we need to be good stewards of time. So managing our time well is really key to having a good mental health in this time, not only in this time, in any time. So prioritizing what is important for us and deciding what to spend our time on based on what is important. And that will be different for each setting and each person and each of you and each of us. But we need to actually make this list of priorities and see which is the order in which we give priority to and use our time accordingly. But that's very important to do. So we need to be good stewards of time. And I see we are also running out of time, so we shall be good stewards of time as well. We'll move to the O. I think the O is really important. Sometimes we do need to open up and seek help. And that help may sometimes be as simple as, opening up and talking to a friend, or opening up and talking to a pastor or a mentor. Sometimes we may even have to approach professionals. And remember, this is key. There are people who are trained in mental health, psychiatrists, psychologists, counselors, social workers, others who have been trained in this, or even good family physicians who have a background in mental health training. All of these people are available to go and share your problems with. Remember, it's better to share and find out you don't have a problem rather than miss a problem and have to deal with the fallout of that later. So these people are all there to hear your problems and tell you if there is something that needs further intervention. Remember that there are interventions there. Sometimes mental health problems need medications. Sometimes they need counseling. Most of the time they need just a listening ear, and hearing out what you have to say will itself have a huge impact on your mental health. So there are interventions available and people who are trained in this. So open up and come out with the problems if you feel you're not able to deal with the problems which are there. So this is a very important part of it, opening up and seeking help when appropriate. We'll move to the final one, which is the W, work-family balance. And I think this is so important. Work is not what, the curse that happened after the fall. If you remember that the first thing God did after he created Adam was he gave him work. He asked him to look after the garden, name the creatures, plenty of things. In fact, he gave work before he created woman. So he actually created work even before he created family. So it's important to remember that work is good. God has given us work. However, God did not stop with creating work. God said it is not good that the man be alone. He created woman. He created the institution of family. So family is also good, and it is part of God's original design of man. We were not created to be alone. It was not good that we were alone. We were meant to be in relationships. Some of us are in family, some of us are bachelors and alone, but yes, we still function in relationship with our friends, with our loved ones, with our colleagues. So we are meant to be in relationship. And this balance between work and relationships is really, really crucial. Neither one should take precedence over the other. There has to be a fine balance between the two. And that balance will be different for each person and each family. I think it's up to each of us to figure out that balance and pray that God shows us the right way to do that. But remember that we must keep those boundaries. Work must remain within its boundary. Family and relationships must remain within their boundary so that both are protected and both are given equal and adequate importance in our life. Never let one dominate over the other, because God wants them in a balance. That's how He created the world, and that's how He wants us to be. So I think with that, I think we've sort of um, covered our rainbow. So we've gone through the various strategies we would like to leave you with. And we'll leave you with this final slide, which talks about what the deluge was. Deluge defined the problem. Rainbow gave some of the solutions to the problem. But let's not forget that at the end, we have to find meaning in this whole story. We have to find the rainbow in our deluge. That doesn't only talk about this pandemic. It talks about any stress or any crisis we're in. We have to find meaning in it. Only when we find meaning in it can we properly cope with it better in a more holistic way, in the way that God wants us to cope with it. So we hope this has given you some clarity on this. Praveen, anything you want to add before we close?
I think we have just touched upon these various aspects. There's a lot more that we could go through, but I think it's crucial that we find meaning. And going back to our original slide, we said, and the best place to find meaning is to understand that this is not random and accident and chaos that is happening. God is moving in an amazing way in spite of all this. And uh, once we realize that God is there behind it and He has a purpose for it, there's a renewal that is coming after it. Let's look to Him and find that meaning, find the times that we are in. These strategies will help us to come out of that situation, finding and understanding why God led us through this so that He can uh, teach us, we can learn from Him and become more like Him in all that we do. So, God is still in charge and He is doing something amazing through these times. That's what we have to remember in this whole situation.
Thank you, Praveen. And I think with that, we'll close our talk for today. We're happy to take any questions that you have. Thank you.